Welcome back. In the last video, we covered the basics of osteochondritis dissecans, what it is, and how it affects the joint. Today, we're diving into how OCD is diagnosed and what treatment options are available. Diagnosing OCD typically starts with imaging tests. Two common methods are the X-ray and the MRI. X-rays primarily show the bones and can reveal whether there's any bone detachment, while MRIs give clearer picture of both the bone and soft tissues, like cartilage and muscles. To take an MRI, you're normally placed in a huge machine which makes random loud sounds. It normally takes around 20 minutes to conduct an MRI. Well, at least for me, it took 20 minutes per knee, so normally 40 minutes. In my case, I had frequent X-rays and MRIs to monitor the progress of the condition. Over time, these tests help my doctors decide the best course of treatment depending on the severity of OCD. Now, let's move on to treatment. The first line of treatment is often non-surgical. This involves resting the joint and avoiding high-impact activities. This is especially recommended for people where OCD is detected early. The goal here is to prevent the lesion from worsening while giving it time to heal. If the lesion doesn't heal with rest, surgical treatment becomes necessary. This usually involves drilling into the bone to stimulate healing, or in severe cases, using implants such as screws to stabilize the area. During surgery, doctors will locate the drilling area with the help of technology and drill there. Depending on the severity of the condition, doctors may have to insert screws into your knee to hold the fractured bone in place. This will either be done using a titanium screw, which will also have to be taken out, or using a biodegradable screw, which will be absorbed in your body. My surgery only involved drilling and no insertion of screws. The drilling was done in order to promote blood flow within the lesion's area. Now, let's hear it from the expert. How is OCD typically diagnosed?
It'll be a combination of patient's history. When patient tell you they have pain and all that, then physical examination. Typically, I will examine and then I feel maybe a catch, or patient cannot straighten the knee fully. And of course, then we do X-rays, and the gold standard probably is MRI.
What diagnostic tests are most commonly used to confirm a case of OCD, and what do these tests reveal?
So, as I mentioned in the previous answer, MRI probably is most diagnostic, and you will pick up a very early stage of OCD. And by late stage, then X-ray and CT scan will see very well.
How do you determine the severity of OCD in a patient?
Severity determined by whether the fragment has separated out from the bone. If it's separate out, then it means very, very severe, advanced stage. When it's very mild, you barely see any changes from outside. However, as I say, when it's severe, the whole piece will detach from here. It comes out and you get to see a fragment. Then you can see poor bone below get exposed, and then you can see bleeding from here. So this is like a different stages of severity of OCD.
What non-surgical treatments are available for OCD, and in what situations are they most effective?
Yeah, so in very early phase stage OCD, as typically so-called grade 1, meaning you can see changes on MRI, some changes on X-ray, but nothing is separated, everything quite good, then you can try non-weight bearing strictly. Just we force the patient to wear a brace and use crutches, and in some extreme cases even put a cast on, like, look, boy, you're not supposed to put a weight nor any activities for 3 months, like long time, and then it has shown that it cure the patient. But of course, it can be more useful if you're young, meaning you are very skeletally immature, meaning you still got a lot of growth potential. and that higher chance. But in a older age group of patients, like you are near the end of growth, then even this method in the early stage may not be useful.
What are the different surgical options available for treating OCD?
So OCD, let's say in stage 2, yeah, where it's not separated yet, then we can do a called drilling. Drilling is, imagine this is a drill. You drill from behind the bone here and go through the bone and bring blood flow to the area. Remember I told you, because there's not enough blood flow in the downstream, so you drill through this, come out here, and blood flow. Then that serves a very good way. However, if on the other hand, big fragments separating, then what you can do is you actually use wire, screw, whatever to fix this fragment back at the cartilage. So this is how you fix back the ways. There are 2 ways of early stage and late stage.
That's all for today. Next time, we'll talk about post-surgery recovery and the importance of physical therapy in getting back to your normal routine. Thank you for watching.